Welcome and thank you for participating in this training. Family violence is a complex and sensitive topic. Please ensure your self-care during this training. The purpose of this training is to ensure that there is a shared understanding of family violence across the lifespan and to give all staff confidence to identify and respond to family violence. During the Victorian Royal Commission into Family Violence, hospitals were identified as being well placed to identify family violence before it gets to crisis stage where police and other authorities are involved. Kooyurup Regional Health Service has family violence in its statement of priorities and can provide a gateway to specialist support services. Family violence is a serious health issue which has profound physical and psychological effects. This is the legal definition for family violence as defined by courts to determine if someone is entitled to a family violence intervention order. It can be any one of these behaviours, it is not just physical. The key word in the definition is fear. This is what differentiates family violence from relationship conflict. It is the use of fear to ensure that one person retains power and control within the relationship. Note how it relates to children. While not all types of violence are criminal offences, by inclusion in this definition, they are still grounds for seeking an intervention order. The Act takes a very broad understanding of family. It includes extended kinship structures in Aboriginal and Torres Strait Islander communities and a carer of the person with a disability if that carer is in a family-like relationship. Family violence is very complex. It occurs throughout the lifespan, affecting girls and boys, women and men. There are many types of abuse. All are a fundamental violation of human rights and unacceptable. And there are many different perpetrators. Not all are men. Family violence occurs in all kinds of families and in family relationships extending beyond intimate partners, parents, siblings, and blood relatives. It includes violence perpetrated by older relatives, by younger family members, or against a same-sex partner. Family violence can be intergenerational, and it is common for victims to become perpetrators. Victims of family violence are predominantly women and children, but males can also be victims, particularly as children and in their older years. Some groups are more vulnerable than others. Women and girls with a disability are 2 times more likely to experience violence, and Aboriginal women are 35 times more likely to be hospitalised because of family violence than other women. The rate of abuse and assault are also vastly underreported, as people don't always recognise the abuse as family violence. We are now going to watch a small video that looks at how society can perpetuate family violence and violence against women.
This is the story of a boy and a girl. It's a universal story and an Australian story. It's a story that occurs every 2 minutes, in fact. A story that happens 657 times a day, every day of the year, and in every kind of household and every city and region across Australia. This is the biggest story behind violence against women. This story doesn't have a happy ending. Because this is the story of how gender inequality contributes to the murder of one Australian woman almost every week. Sounds like a tall tale, right? Let's take things back to the start. Here's the story of a regular woman. As a girl, she gets told how pretty she is, never how clever she is, that if she wears a short dress, she's asking for it. She grows up and gets used to being harassed by men on the street. That's just the way it is. Here's the story of a regular man. As a boy, he learns that women aren't equal to men from a very early age. Even though both his parents work, on the weekends his mum does the housework while dad watches sport. When he cries about being bullied at school, his dad tells him to stop being such a girl and just punch him right back. Technically speaking, we'd say that these social norms, practices and structures have shaped both the boy and the girl, creating a society where women are valued less and men are expected to be dominant and in control. In such a world, disrespect and hostility is excused and violence against women is far more likely. But back to our story. The girl grows up into a woman, the boy grows into a man, and they begin to date. He jokes that he hopes she doesn't get fat now that we're together. She's not sure whether she should laugh. They have the same education and do similar work, yet he earns more money. He's quickly promoted, like other men in the company, while she gets overlooked. At home, she does all the household chores, and he takes control of their joint finances, seeing as he's the main breadwinner and all. When they're at the pub, he puts her down in front of his mates. His friends stay quiet. In the morning, he wakes up and blames the alcohol. And stress, he always has an excuse. When she gets pregnant, her boss says she can't come back part-time. After the baby is born, the lack of flexible job opportunities and childcare keeps her out of the workforce. She is socially isolated and financially dependent on him. He controls decision-making, and her. They are not equals. She is dependent on him for everything. So she never tells anyone that he has started to hit her. She doesn't say anything to her family or friends. She grows more isolated. She has nothing else but him, so she lives with the violence until their story ends, one way or another. This story isn't a one-off. It's a story shared by 1 in 4 Australian women who have experienced physical or sexual violence from a current or former partner. And it's a story of 1 in 5 women since the age of 15 who experience sexual violence, including rape, 1 in 4 emotional violence, and 1 in 3 women physical violence. But it's also a story that affects children. More than half of the women who experienced violence had children in their care when the violence occurred. For victims and perpetrators, violence against women is the conclusion often reached after a life lived in a society where women and men aren't treated equally. But we, you and I, can change the narrative. Better education, policies, practices, support and funding can prevent this all too common story. When women and men have equal power, value, and opportunities in relationships and in society, violence against women is less likely. By nurturing caring, respectful, and equal relationships, and by creating equitable and inclusive communities, workplaces, and institutions, we can create a society of equality and respect, where violence against women is unthinkable. Let's change the story, because ending violence against women starts with gender equality.
Here are some statements about family violence that you might have seen or heard. Note that these mainly focus on what the person experiencing family violence does not do, rather than questioning perpetrator behaviour. They distort and excuse, minimise and perpetuate family violence. So what keeps people from disclosing? They may never have been asked. They may have had a bad experience in the past or lack trust in the system. They don't know their rights or think the behaviour is normal. They may have a dependence upon the person who is the perpetrator, have a language or communication barrier, or just feel ashamed. So what can we do in our hospital to make it easier for these people to disclose family violence and seek support? We can recognise the signs, make sensitive practice our standard practice by being non-judgmental, create a safe and private environment out of public view and earshot. Remember appropriate use of interpreters. They must be professional and not family or friends. And be aware it is not always safe to ask about family violence, especially if others are present. Sensitive practice is an approach that increases and elicits feelings of safety, respect and control. Sensitive practice is a trauma-informed care model. Take time to listen without judging, build rapport, give supportive responses, and offer choices without telling people what to do. Sensitive practice is a 6-step process. Notice the signs, sensitively inquire, respond respectfully, make an action plan, provide options, and document as required. Step 1 is to notice the signs. While the physical symptoms arising from family violence may be apparent, other impacts of trauma may be less obvious. It can seem hard to make a sensitive inquiry. This may be due to a lack of private space or an intrusive or aggressive partner, time and workflow issues, or simply being scared of what the patient will say and not knowing how to respond. Non-verbal information can have a valuable educative impact. Badges and posters can alert them to the fact that they can talk with you or someone at the hospital. We must ask ourselves, are the conditions right to make a sensitive inquiry? Is the patient alone, separate from a partner or other family members? Are there children present? Can the conversation be overheard? Is an interpreter required? The inquiry must not increase the risk for the patient, so only ask if it is safe to do so. The purpose of a framing statement is to position the inquiry about family violence as a routine part of hospital activities, to normalise it. You need to frame a statement that works for you so that it is authentic, not scripted. It may feel uncomfortable, but you ask a lot of uncomfortable questions in clinical practice. International evidence suggests that asking these types of prompting questions will not offend people or put them at risk. Tailor your questions to the individual, whether it be a child, adult, older person, or person with a disability. Prompting questions should move from more general to more specific, depending on what the patient discloses, and monitoring their comfort with the process as you proceed. Don't forget to ask about the safety of children who may not be present. How we respond is crucial to eliciting feelings of safety, respect, and control for the patient, and it can make a big difference. Being listened to can be an empowering experience for a person who has been abused. Show them that you understand and believe them. Assure them that they are not to blame. Ask what the patient's immediate concerns are and provide support by helping to connect to information, services, or social support. Helpful responses validate, offer support to enhance safety, assigns accountability to the perpetrator, places control with the patient, and makes support unconditional. Non-helpful statements blame the person experiencing violence, fails to understand the complexity of the issue, and diminishes perpetrator responsibility. The next step is to assess the risk and develop a safety plan. Professional assistance may be needed at this stage. Any physical, behavioural, or psychological signs combined with the risks are a red flag warning for health professionals. The role of the clinician is to notice the signs, sensitively inquire, and respond respectfully. Clinicians are not expected to be family violence experts or to fix the problem. If you identify clinical signs and risk factors, seek expert advice. If the patient has consented to you helping them get more support, refer to our social worker or a specialist service, which are available 24/7. Social workers are the internal specialist service to offer patients, if they want to speak to someone more comprehensively in the moment about their experience. In the instances where patients decline assistance from a social worker, refer to specialist family violence services. In the instance where the patient declines assistance full stop, provide information, for they may change their mind. Action planning is the responsibility of social workers and specialist family violence services. There are occasions where professional judgment may override the patient's own assessment. This includes where a person has cognitive issues that impact on their capacity for decision making, or where parents are underestimating or minimising the effects the violence has upon their children. Always remember, you do not need to be a family violence expert. At a professional level, we need to recognise and address the need for self-care as an important part of doing our job well. To support our staff doing this work, we have in place various support options. Sometimes simply sharing our emotions with colleagues, family and friends can provide the debrief that we need, and sometimes more professional support is required. The statistics tell us that family violence will undoubtedly affect some of our staff directly. To support our staff, we have policies around leave and support services, including free access to counselling services. The Employee Assistance Program provides free confidential sessions with the KRHS social worker, direct access to 2 to 3 free counselling sessions, your choice of service providers, and up to 20 days of family violence leave. So our key messages are: family violence affects people across their lifespan. Look for non-physical signs. Create an atmosphere of safety and support. We're not expecting you to be a family violence expert. There is support available 24/7. Thank you for completing this training. Please complete the rest of the survey now.